What's up, everyone? This is Dr. Kaan dropping a new video here on the ACL Academy page. Common complaint that we get from people as we're working some flexion ranges, some pinching in the back, particularly like kind of like right behind the joint itself. Sometimes people describe it as like a pinching in the hamstring muscle. And a lot of times you'll feel this in deeper flexion ranges. And I'm going to show you a quick trick and some different positions that you could work it in today. Before I get more involved in that, please, if you've been following along, found some value in our videos, subscribe to our channel, like the video. You got questions, comments, drop them below. You basically get to every single one, and more importantly, share with a fellow ACLer that can benefit from these tips and education. We put out a new video every single Monday, and if you're looking for more customized coaching, a program with your ACL recovery, reach out to us directly. There's some contact information below. So pinching, especially with deep flexion ranges, deep bending ranges, and more so with weight-bearing flexion. It's a common occurrence that we get. A lot of times it's really described directly in the back of the joint. Maybe sometimes it's one-sided. Can feel like some hamstring tightness. Can also feel like maybe the backside of the joint. There's a capsule that lives there. That could be getting some pinching in there. And sometimes a little swelling that kind of forms there. You have a little Baker cyst that can also be bothersome. So little tip, little trick that we utilize is a towel. So you can use a bath towel, roll it up. You can work with some different thicknesses there. And now I'm going to just show you some ways that we can place it behind the knee joint to provide some traction. So I'm going to start with some non-weight bearing more and then add more and more weight bearing ways. So the first way that I would do it is you'd be on your back, okay, in a position like this. And if you were working the range and you were starting to get a pinch right in the backside here, what you would do is you would take a towel, place it in the back, kind of hold it firmly there, and then gently let the knee fall over it. Okay, so the reason that we use a towel here is to provide a little bit of traction in the knee joint, a little separation, and it provides a little comfort. Now, if this is feeling okay, then what you can do is take your hand, pull it on the shin, and then start to work a little deeper into the range. So what I would do is if it's comfortable or it's even low-level pain, I would sit here 20 to 30 seconds and then give it a stretch. Okay, and then so you could work some dynamic hamstring stretches that way. And you could do about 10 of those. And then same thing, you would take the towel, drop it back down, and it feels comfortable. Try to throw some weight into it. Hold 30 to 60 seconds, and then repeat with a stretch like that. Okay, so that's one way that I would utilize it non-weight bearing. The second way that you could do it is a little bit more weight bearing, not full weight, but you would place your foot on top of a seat or a bench here. Okay, so go right on top, and depending on where you're working in the range, where you're comfortable, the towel would be placed behind here, and then we'd slowly get a little weight into that range. So I'll give you a side profile so you can see what I'm doing here. And basically use your hands to keep and wedge it into that area. You could do it the same way that I showed you, the one laying on my back. You're holding for 30 to 60 seconds here. And then you could repeat as a mobilization. So you're coming in and out of it, kind of holding the towel in place to give me some relief there. And then I'm maybe doing 10, 12 reps just like that, mobilizing as deep as I feel comfortable. You could even get further in the range as you'd like. And then once the 10, 12 reps are done, do a nice static hold again. So take up more range and then see if you could hang out here again for another 30, 60 seconds. And you'd back out of it and then do your reps again. So that's two ways that I utilize it. Then if you want to get even more aggressive than that, weight bearing wise, you'd get into a kneel position. So these are for people that are a little further down the road and try to work on those end ranges. And if you go to sit on your knees, you're doing the shift, right? So you're shifting out of that position. So a towel will help, again, provide some traction. And also another tip, you can use a pillow as well to give you a little bit more cushion than this. And if this is not thick enough, you use a bigger bath towel and make it thicker. Well, basically what we're trying to do is get this guy, again, wedge right into the armpit of the knee there, and then we're sitting down on it. Just as we did previously, you do a hold for 30 to 60 seconds, and then once you do the hold and feel comfortable for that position, then we would do it more as a mobilization, right? So we're coming in and out of it. You're trying to go deeper and deeper. So you do your reps that way, okay? And then you could repeat this, right? Same thing, 30, 60 seconds. Try to let yourself sink into it, try to relax into it, breathe into it. And then after that 30 to 60 seconds, you will work the new mobilization range of motion. So you're coming in and out of that deep range. If you want to get even more aggressive than that, you would go to a one-legged half kneel, right? So now, towel gets placed behind the back. We're trying to sit down into it. We'd hold here 30 to 60 seconds and then come out of it. And then we would sit as a mobilization. So we're trying to rock back and forth, deeper and deeper in the ranges there. And then you'd repeat that a few times. So you go from laying your back to a standing modified position. Then once you're in that modified position, we'd go into a double kneel and then a single kneel. So those are ways that you could kind of take and work little by little deep weighted range. And we use the towel trick to help, as I said, provide a little bit of traction to that knee joint and give you a little separation and provide some relief to take whatever pressure that is you're having back there, whether it's a little swelling, whether it's the tendon or the backside of the joint getting a little pinched. Now, a couple tricks with this. I showed you with a towel. This is like two little small bath towels rolled together. Okay, I like this because it's small enough to kind of wedge in there. You can use a bigger bath towel, so it'll be a little thicker than this, depending on where you are in the range of motion, right? The thicker the towel, it's going to limit your motion a little bit, but some of you may not be at that deeper ranges, so it could be beneficial. And the other thing that I said before, towel, not a towel, pillow, right? So when you're kneeling, that could also help with some cushion. So I really love this trick. I utilize it a lot, especially as people are getting further into the flexion ranges, those bending ranges, and they're getting into weighted flexion. Super easy, simple to use, provides a ton of relief, and then you could play with the thickness, right? As I feel more and more comfortable in deeper ranges, I'm going to unroll this a little bit. I'm going to make it a little smaller and smaller and smaller until I don't need the towel at all. Hope that helps, guys. If you have questions, comments, drop them below. If you found value of this, like the video, subscribe to our channel, and more importantly, share with a fellow ACL that can benefit from these tips and education.